Hi, this is Dr. Wells from Wells Medicine, and I wanted to speak a little bit today about the medications and some non-medications that affect the efficacy of ketamine treatments. A lot of people are very worried that their home medications might interfere with their ketamine treatment. So, ketamine is an unusual medication in that it plays very well with almost every other medication. So, if you're on an SSRI like Paxil or Prozac, or an SNRI, or Wellbutrin, or an MAOI, or a mood stabilizer, ketamine doesn't interfere with those medications, and those medications in general don't interfere with the ketamine. There are some notable exceptions. So, medications in the benzodiazepine class of medications, those medications are Xanax, Valium, Ativan, Klonopin. Those are the most common benzodiazepines. Those can slow down the changes that we see with ketamine. So, anything that a patient might notice after the first infusion, a patient on daily chronic benzodiazepines might notice after the second or third infusion of ketamine. A patient not on benzodiazepines might get 3 to 5 weeks of benefit after finishing their first 6 infusions, but a patient on chronic benzodiazepines might only get 2 weeks at the beginning. So, benzodiazepines we think of as mitigators, which means it slows it down or decreases the effect, but it doesn't prevent it. A lot of people on benzodiazepines want to know if I want them to stop their benzodiazepines or if they have to stop their benzodiazepines before treatment. And we don't ask that they do that. First of all, it's very difficult to wean down or come off of benzodiazepines. That needs to be done very carefully over a long period of time, with the prescriber's help, and with a lot of support. And really, I think is best done when patients are feeling a little bit better. So there's some really good reasons to do the ketamine treatment even when patients are on benzodiazepines, even when that's going to slow it down a little bit. Because when they're feeling a little bit better, when they've kind of got their feet under them a little bit more, it'll be easier for them to then come off benzodiazepines, which again, it's very difficult to wean off or come off benzodiazepines completely. We usually say just hold the benzodiazepines that morning, or if that's not possible, just take your benzodiazepines as normal, and we'll just do an extra infusion on the end of your 6 treatments, and we'll keep you a little bit closer together. As you're starting to space out the treatments, and a little bit closer together too as you start to wean down on your benzodiazepine dose. Another class of medications that is very similar to benzodiazepines are the gabapentinoids, Ambien, gabapentin, Lyrica, those other medications that also act on the GABA receptor. Sometimes we do see those slowing the effect of ketamine down a little bit, but it's a lot more variable than the effect that we see with typical benzodiazepines. Another medication that is very variable is Lamictal or Lamotrigine. That is a mood stabilizer medication that is sometimes used for augmenting depression medications, but is also used very typically in bipolar. Lamictal or lamotrigine has an unusual effect in that for some patients, it doesn't seem to affect the ketamine at all. And for some patients, it dramatically increases the amount of ketamine that we need to have them feel very floaty, very spacey, to have a typical ketamine experience. Now, that doesn't necessarily say that it increases the dose needed to have the beneficial effects of ketamine on mood, but we usually increase the dose anyway in those situations, because a more typical ketamine experience is often felt by the patients to be more beneficial. So for those patients, we just say, take your Lamictal or don't take your Lamictal, but either way, have that be the same each time you come in for ketamine treatment. So for example, don't take it before treatment one time and then the next time skip the dose. We find that that just creates a lot of variability in the experience of a ketamine infusion and in the doses needed to have a stable experiential effect. Those are the medications that we see affecting ketamine. Some non-medication things that we see affecting ketamine, alcohol dramatically decreases the benefits of ketamine, not only because alcohol works in the body as a GABA agonist as well, but also because alcohol decreases motivation, it decreases your desire to make those lifestyle changes. And similarly, we see a lot of issues with THC or cannabis products, also decreasing motivation, decreasing the ability to make those changes, and probably causing some anxiety and depression as well. And those, as well as the benzodiazepines, we don't want someone to come off of cold turkey. We want a slow, gradual wean with a provider's assistance. In summary, there are very few things that affect ketamine infusions. Benzodiazepines, alcohol, THC or cannabis products decrease the effectiveness of ketamine, and Lamotrigine or Lamictal sometimes needs to have dosing adjustment of the amount of ketamine in infusions.